Welcome to Health Talk. This program is directed to families who are expecting a new baby. We will be discussing the need for childbirth classes, labor and delivery, kangaroo care, and neonatal intensive care. Now let's meet our guests.
My name is Rita Crum. I'm a staff development specialist at Pikeville Medical Center. I also teach the childbirth classes at the hospital. I have 11 years of nursing experience, 9 of those years in labor and delivery, 2 years in ER. Before I became a nurse, I was actually an elementary school teacher for 5 years, and because of my experiences in education and nursing, that kind of led me to where I am now, which is staff development specialist and an educator.
Hi, I'm Tammy Blankenship. I am the Director of Women's Services at the hospital, and basically what that means is OB, labor and delivery, NICU, and newborn nursery. We also take care of some GYN patients. Prior to that, I worked in labor and delivery for about 30 years, so I've had the pleasure of seeing many babies born.
My name is Jeanette Sexton. I have worked at PMC for 20 years as a registered nurse. I've worked in the neonatal intensive care unit for 15 of those years, and now I am the clinical manager of NICU and newborn nursery.
When should someone come to the hospital?
I talk extensively about the signs and symptoms of labor in childbirth classes. I go as far as to teach the participants how to feel their tummies to tell if they're having contractions or not. Usually the participants in childbirth classes are first-time moms, so I encourage them to stay home as long as possible. Then come into the hospital when the contractions are more regular, every 4 to 5 minutes apart and lasting for about an hour.
How is the baby monitored during labor at PMC?
Actually, we have surveillance monitoring, and basically what that means is every area in the labor and delivery department that we go to, whether we go into another patient room or we go at the nurse's station, we have our monitors are set up so we can always watch your baby at all times. Also, our physicians have access to the monitor system in their offices and in their homes, and at any time that they want to, they can pick it up and look at it also.
What can I have for pain?
Well, you know, one good thing about the childbirth classes is there's another thing that Rita goes over in the childbirth classes is what you can have for pain and at what times you can have the pain medication. We do offer epidurals, and I'm sure everyone's heard of epidurals. We offer epidurals to have 24-hour service from our anesthesiologist. As soon as your doctor makes the decision that it's okay for you to have an epidural, we can start with that. Other than that, pain medication, it just depends on your doctor.
In our childbirth classes, there is one class that's focused on pain management, and within that class we have one of the anesthesiologists that comes in and holds a question-answer sort of class with the participants, and they can ask any questions and talk about any concerns they may have about the epidural itself.
What is the visitation policy for the hospital?
Currently, our hospital visitation policy is sort of an open-door policy. There are some restrictions and some things that you have to take into consideration.
You know, and I agree with Rita, during flu season. During flu season, we're very strict, and we don't allow children at all on their floor except for the siblings of the baby, and we also assess them to make sure they're not sick when they're visiting their moms. Any other outbreak in the area or anything like that, we're also very strict with that.
In NICU, or neonatal intensive care unit, we also have an open policy, as what the girls had said earlier, but there are times that we do close the unit. We close it down for any type of special procedures that we do or any new admissions, but we do open it up as soon as possible.
What kind of infant security system does the hospital offer?
The infant security system that we use at the hospital is actually the HALO system. It is a tracking system and a lockdown system. We actually have lockdown units as well. Our labor room, nursery, and NICU are locked down. We start with infant security immediately after delivery. We use coded bands for the infant and the mother. We do footprints and fingerprints before we ever leave the room. When the infant goes to the newborn nursery, before they come back out of the newborn nursery to your room, we'll actually put a tracking sensor on the baby so we can monitor exactly where your baby is at all times. And anytime the infant gets too close to an exit, whether it be a stairwell or an elevator, it's going to completely lock down the floor, and even the stairwell doors won't open. So
And also our security is also alerted if it does alarm. It goes all the way to our security system, and they do respond also with it. But as Rita had mentioned before, NICU and newborn nursery are locked, period locked. They have to pick up a phone before anyone can come inside of the units. And also, we also make sure that if anyone's calling about any information about our babies in NICU, that there is a password. We do have passwords that they do have to give before we give any information out.
Would it be wise for me to write down my birth plan?
Yes, we're very open about depending on what you want to do, I guess. First thing you need to do is talk to your physician. Prepare a plan and take it to your physician first of all, and then he will or she will look at it, and if it's something we can accommodate, we will do just about anything you ask. Our number one goal, of course, is safety for you and the baby, and within reason, then we will do just about what we can do for you.
What is Kangaroo Care?
One of the most exciting things that we've been implementing at Pikeville Medical Center lately is Kangaroo Care. And basically, Kangaroo Care is just a special way to hold your baby. You hold your baby immediately after delivery, skin to skin. The infant just transitions better into this world. There are so many benefits, and I talk again extensively about all the benefits of Kangaroo Care in the childbirth classes. The baby holds its temperature better, the heart rate is stabilized, the blood sugars are stabilized, respirations are stabilized, and there's much less crying, which is proven to be much better for the infant itself. As far as being mandatory, it is our policy and it's our belief that it's the best possible care for infants and mothers after delivery. But you're the patient and you make the decision. If it's something that you don't want to do, then obviously we'll abide by your wishes at that point. In the C-section room, that really is a case-by-case basis. There are different factors that affect that. The medications that the mother may have been given, whether or not it was an emergency section or something that was planned that we knew was going to happen. So really that's a case-by-case basis. But as far as vaginal delivery, we strongly encourage all of our mothers to participate in Kangaroo Care after delivery.
Kind of adding some things to what Rita had said, NICU has been using Kangaroo Care for a while. NICU, we do Kangaroo Care, and it's really based upon how the baby is stable, if the baby is able to do Kangaroo Care. But we also, besides all the things Rita added why we do Kangaroo Care, there's another reason why NICU that we do it. It's for bonding. A lot of times the technology gets in the way of NICU, gets in the way of a bonding between a mother and a baby. So this Kangaroo Care really does help. We have privacy. We can pull the curtains, and the mother and the baby has privacy at that time when they do the Kangaroo Care.
How does Kangaroo Care help with breastfeeding?
The skin-to-skin contact care with the mother immediately after delivery is just natural. And when you lay the infant skin-to-skin with mom, you're allowing the infant to kind of calm down, to slowly transition into the world. A few minutes, maybe 15, 20 minutes after, baby's going to become a lot more active and is just naturally going to, with the sense of the mother and the warmth of the mother, reach for the breast and actually kind of move down a little bit, sometimes with the mother's help, and naturally latch on to the breast. So it's just part of that natural process of mother and child and breastfeeding.
Will the baby stay with me after delivery, or will it go to the nursery?
Well, the baby, after the Kangaroo Care, will come to the nursery so we can check the baby out and do a quick assessment, make sure the baby is doing fine. We monitor the baby for a little bit to make sure that there is no problems that does arise. And once the pediatrician says, and once everything is fine and we've okayed the baby will go out with the mom as soon as possible.
What would happen if my baby has to go to the NICU?
Well, unfortunately, some babies have problems at birth. I know no one thinks that, no one wants that to happen, but it does happen. And we are so lucky to have our NICU. Our NICU is a regional NICU. That's one of the good things that we offer at the hospital. But once the baby does come to NICU, what we'll do is, first and foremost, is we have to stabilize the baby. Once the baby has been stabilized, we do update the parents as we're stabilizing the baby. But once the baby is stabilized, we try to get the parents in as much as possible and as quick as possible.
From a mom's standpoint, one of the things as far as the NICU goes, with my last delivery, I was expecting a completely healthy baby. It was a scheduled section. She came out, she was having a little bit of breathing issues, and she actually spent 6 days in the NICU, and we weren't expecting that at all. But from the mom standpoint of that, just knowing that I have that peace of mind that if anything goes wrong, there's a neonatologist on call 24/7, always there, not on call, actually in the hospital 24/7, and I have the NICU and all those special nurses that know how to take care of your infant, so that I'm not at one hospital and my infant has to be transferred to another hospital. It's nice to know that the baby is going to be there with you if something happens to go wrong.
What makes delivering different at PMC than other hospitals?
Well, at Pikeville Medical Center, we have the best nurses in the world, for one thing. We do have nurses that have been there for quite some time. They're very experienced, very educated, very competent, have seen many births, and have very little turnover. Our nurses love our department. Our nurses love what they're doing. You will see it when you come. You will notice that it's just their pride and joy, and they love what they're doing.
Another great reason to come to PMC is our NICU. It is a great thing to have to have the opportunity if something happens to your baby, if your baby is sick, that we do offer this. We have doctors on call, a neonatologist as 24/7. They are available for any type of emergencies that do happen. We also have some wonderful NICU nurses that are specially trained, just trained for NICU.
We also have a very fine group of physicians that work at Pikeville Medical Center. We have 6 OBGYNs on staff now, 3 females, 3 males. And that offers, some people would prefer to see a male, some would prefer to see a female, and so that gives you the opportunity to kind of pick and choose. We have Dr. Crum, Dr. McClellan, Dr. McGuire, Dr. McCowan, and Dr. Mullins that are in the office on Town Mountain, and then we have Dr. Maggard that has an office in Harold. So excellent physicians, all very competent and wonderful, excellent bedside manners.
Does the hospital provide anything for the parents after the baby is born?
One of the very special things that we do, and it's very important to us and very important to you that we educate you on everything that you need to know. We want you to be comfortable taking care of your baby. We want you to be comfortable taking your baby home, and also have all the knowledge that you need to take care of yourself. We start our education at the beginning when you first are admitted, and we never finish even after you go home. You're very welcome to call us back with any questions or anything like that. Now, as far as other things that we do, one special thing that we have started recently is giving a congratulatory dinner for our special mom and dad the evening after they have the baby. Usually we have very wonderful chefs that prepare a special dinner just for the two. Of course, and the special dinners are just our way of thanking you for coming to PMC and congratulating you on your new baby.
Does the hospital offer childbirthing classes during pregnancy?
We've mentioned to you throughout the entire program that we do offer free childbirth classes at Pikeville Medical Center. The childbirth classes are a little different than your typical childbirth classes. The purpose is just to empower and give you information. So when you come, we're not going to be talking about things such as Lamaze and that kind of thing. We're going to actually talk about signs for when you should come to the hospital, what you should bring with you to the hospital. We'll talk about the epidurals. We'll also do infant CPR and choking. I'll give you some skills to learn that help you take care of your baby when you go home. And we also talk about breastfeeding, lots of different topics. And the way that the classes work, they're every Tuesday. A new set of classes starts at the beginning of the month. So on the first Tuesday of the month, we have the first class for that group, and you'll come for 4 Tuesdays, and we'll talk about different topics, and then after that month is over, your classes will be over. The best time to come is probably going to be around 32 weeks, around about in there, so that we can make sure we get all 4 sessions in. If you have any other questions, please contact me at the Hospital Education Building. The number is 218-3525.
Also, I'd like to add, we are very family-oriented at Pikeville Medical Center. We want your family included in this birth. We want especially your other children. We want any other family members that you think are very special and you like to be there at that time. We also want you to know everything that you should know before you have a baby. It's very important to be well educated. Our childbirth classes, we do a lot of other education. We want everyone to know exactly what they need to know, and we want you to be prepared.
Thank you for joining us for Health Talk. If you have questions about our classes or practices available at Pikeville Medical Center, don't hesitate to stop by or give us a call.